Since the pandemic hit, these masks have been extremely hard to secure. The whole world wants them. But 3M Canada came through for Ontario.
This is part of our Made in Canada plan to find solutions to COVID-19. This will keep our frontline workers safe and secure domestic PPE production for years to come.
Ontario Premier Doug Ford says he doesn't want to be at the mercy of foreign stockpiles of personal protective equipment ever again. He says that's why his government has teamed up with the feds to strike a deal to make N95 masks here at home. Ontario and Ottawa will each kick in $23 million for 3M to manufacture N95s at a Brockville, Ontario plant. 3M is also investing $23 million to increase its plant capacity, allowing it to produce up to 100 million medical masks a year. Anita Anand is the Minister of Public Service and Procurement. I spoke to her earlier, just after today's announcement from Brockville, Ontario. Minister Anand, thanks for joining us.
Thanks for having me.
So this is a $70 million investment. Two-thirds of it is going to be covered by the federal and the provincial government. Did the governments have to pay a premium here to get this established because of the competition for N95s?
Well, let me tell you that our relationship with 3M has been a strong one throughout the pandemic, and they have made sure that Canada has an influx of masks from the United States of up to 500,000 N95s per month. So when it came time to negotiating this transaction, we had a good relationship in place with 3M, and the transaction that you just described does see us splitting the capital costs one-third, 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 and that is a testament to the way in which these negotiations have proceeded in a very, I would say, amenable and friendly, respectful way.
Right, but we do have taxpayers picking up two-thirds of this and agreeing to a longer-term purchasing agreement, which is certainly going to be lucrative for the company. And I'm not casting any aspersions on this. I'm just wondering if this is the kind of price that governments have to pay when everybody in the world is looking for N95s.
Well, let me tell you that we are negotiating the price per mask at the current time with 3M, and they have been very forthcoming in terms of not seeking a premium on these masks. They recognize that what they're doing is important for Canadians, and especially those in essential services. And once again, I am very pleased to have been working with 3M as well as the province of Ontario on this important deal, which really serves Canadians, David, and I'm so happy that we've been able to announce it today.
So I just want to walk through some of the numbers here to make sure I'm correct on this. The factory, when it's, or the production line, once it's established, will produce about 100 million masks a year. 50 million of those will go to governments, 25 million to Ontario, 25 million to the federal government. Does that make Canada self-sufficient? Is that enough to cover the burn rate on N95 masks, or will you still need extras from, say, Medicom or to buy on the global market?
Well, it's a very good question, and I wish I had a crystal ball, because the question that you're asking does require us to understand the ways in which this pandemic is going to take hold across the country, and it's a question that none of us knows. Having said that, what we have done in procurement is to make sure that we have in place long-term contracts from a diverse range of suppliers, both domestically and internationally, so that we can be prepared for any scenario. So the Medicom contract, the 3M contract are extremely important for N95 supplies within Canada, but we are also making sure that we have a diverse range of suppliers to be ready for any eventuality.
Right, because this particular facility, the expanded facility you're standing in, that's not going to start producing until 2021. If there is a second wave, that would be on the other side of the second wave, right? Because most experts tell us that that would happen this fall. So how secure is the N95 supply for at the federal level and just at the national level to get us to the production time at the plant you're in now?
Well, thanks again for the question. It does contemplate me being an oracle of sorts and having a crystal ball. We have received N95 masks from our international suppliers, and we are well placed for the short and the long term in that respect. But what we want to make sure is that we have stable supply chains in place in Canada, and we need to be ready for any eventuality. And that is the purpose of us establishing diverse supply chains within Canada and internationally. It's exactly what we've been working on. It's an aggressive approach, but we need to make sure if anything goes wrong with those primary supply chains, we have secondary, we have tertiary supply chains in place so that our essential service workers, so that our frontline healthcare providers have the equipment they need to keep Canadians safe.
But you have had problems with some of the masks that you've bought from China, for example. When they get here, they're not up to the N95 level that is required for frontline health workers. We've heard anecdotally that nurses and doctors, for example, prefer 3M over, say, the mask that you get from China just because of brand trust and they like the fit of the mask. So how good are your supply lines right now to get us through the fall, where everyone's worried that a flu season could come on top of the pandemic?
So, David, we disclose all of our PPE orders and deliveries on our website. And if you take a look at that website, you will see that our deliveries are especially good for PPE and that we are ready for the fall and will be ready for the long term. And these contracts that we're putting in place with 3M and Medicom, for example, are for the long term so that we can be ready for any eventuality. On the issue of quality control, we have hundreds of contracts in place with domestic and international suppliers, and we have had quality control issues with just one or two of those hundreds of contracts. So I want to emphasize that we put in place very stringent quality assurance mechanisms and controls so that before equipment was distributed to frontline healthcare workers, they passed the Public Health Agency of Canada's testing, and we did not ever release equipment out that did not pass testing.
So there was some quality control issues with bulk orders from places like China, but there was also supply chain interruptions early when U.S. President Donald Trump blocked shipments of critical PPE from leaving his country. Now, that got resolved because of this flurry of high-level diplomacy, but how much did the disruption at the Canada-U.S. border, factor into your decision to move forward with an arrangement like this?
Well, David, there's an assumption in your question about how the issue got resolved. And I will say we were working very hard over a number of days on all fronts to make sure that our PPE, and in particular these N95 masks, cross the border. And in particular, I'd like to have a shout out to Penny Wise, the CEO of 3M Canada, with whom I spoke regularly to ensure that Canada could get its 3M masks over the border and into the hands of frontline healthcare workers.
Okay, I want to switch to something else, and we have news breaking today from our colleague Justin Ling at Vice News, and it's more stuff about some lobbying and ethical questions about at the highest level of the government. And the report is that Rob Silver, who is married to Katie Telford, the Chief of Staff to the Prime Minister, lobbied on behalf of his company, lobbied senior officials in Bill Morneau's office and a senior advisor in the Prime Minister's office to make changes to the wage subsidy that would allow the company he works for to qualify. As a cabinet minister, were you notified of any of these contacts by Mr. Silver? Were you aware this happened?
Well, thanks for the question. I will say that the extent of my knowledge in terms of this file is particularly limited to what I have read and what I know that the Prime Minister's office and in particular the Chief of Staff have disclosed, which is that she went to the Conflict of Interest Commissioner, she talked to that office about the potential conflict, she made sure that she went over and above to set up her own screen. And that is a process that I think stands and should stand the test of time.
Are you troubled at all by the fact that there continues to be this drip, drip, drip of revelations of points of contact between people very close to the Prime Minister or to the Prime Minister's most senior people, either on the We Charity controversy and now on the wage subsidy file, that this keeps coming out and fueling the narrative of ethical problems inside your government?
Listen, I am a big believer in process. I'm a law professor and a lawyer by training. I know the rules relating to process. And from what I can see, we are very much abiding by the procedural mechanisms that are in place. We are complying with the requests from committees. We have disclosed 5,000 pages of documents for the House of Commons committees. And in addition, both the Prime Minister and former Finance Minister Morneau have been complying with the Conflict of Interest Commissioner's office, and we have had numerous testimonies before House committees. So in my mind, that's transparency, and that's an attempt to comply with the procedural mechanisms.
That's how you see it. Minister, how do you think Canadians see it?
Well, I'm a representative of Canadians, and I'm a representative in the riding of Oakville. And I sit in the House of Commons as a member of Parliament, and our government is going to come back to the House of Commons on September 23rd, and we are going to have a speech from the throne, which will say and set forth a plan for Canadians. And at that point, Canadians themselves can decide what it is that they would prefer for the long-term vision of our country and our economy.
Okay, Minister Anand, thank you so much for joining us.
Thanks so much. Take care.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.